So next we're going to talk about abdominal palpation, and this is a skill that takes a lot of practice to really get good at. And I remember being a student where pretty much most of palpation in the abdomen just felt like mush. I couldn't really identify much in the way of structures in the abdomen. And it comes with time. If you practice over and over again, you'll get to the point where you can feel much more. And again, back to the principles, you want to try and do it in a way that's comfortable for the animal, and you want to optimize your positioning so that you'll be able to feel what you need to feel. And those points really make a huge difference in being able to palpate the abdomen, probably more than most other areas, those 2 points. And what you have to sacrifice, though, is that this is not going to be ergonomic for you as a veterinarian. To do abdominal palpation, you have to put yourself in a sort of an awkward position in order to do it well. And I'll talk about several different techniques for doing it and the pros and cons of the various ways. So first, for most of the structures in the abdomen are oriented in a sagittal plane. Like the colon goes from cranial to caudal. The spleen can be crossways, but it commonly is oriented in a cranial to caudal direction. And so, and most things hang from the top, those that hang. And so you're going to optimize your chances for palpating things if you're actually starting at the top and pulling ventrally. And so what I recommend that you do, particularly when you're starting out, is to optimize your conditions is to actually put one hand between the legs so they can't sit down. And you want to put your hands along the lateral aspect of their abdomen such that your fingers are pointing straight towards the ceiling. And I often joke that dogs were made perfectly for humans to palpate them because the costal arch perfectly matches the arch of my fingers, or the angle of my fingers. And so you know where to put your hands because it fits right there. And you don't want to use your hands like this. You don't want to curl your fingers in because that's going to be painful. If you're doing abdominal palpation correctly, it doesn't hurt. This also gets to one of the other S's I talked about before where you have to slow down. Abdominal palpation, if you do it fast, it's more likely to be painful for the patient. So you want to keep your fingers flat. Poking in like this is uncomfortable. Laying your hands flat on your abdomen is much more comfortable. So you want to keep your hands flat, pointed towards the ceiling. I'll go over more about that in a second. And you want to just press gently, typically 3 to 4 breaths. The dog will, Westy's very compliant, so relaxes very quickly, but other animals you might have to wait a little bit longer. And you're just pressing and holding while those muscles fatigue. The muscles will fatigue eventually. They'll get to the point where you can feel either your fingers touching each other or you have colon between your fingers. And so once you've got the muscles fatigued, then you can slide ventrally. Again, most things in palpation are about sliding. And so you're going to slide ventrally, allowing things to slide between your fingers. You're starting right behind the costal arch. As you're sliding your fingers, you need to maintain the tension with your wrist muscles to maintain the muscles fatigued. But you need to be flexible with your fingers to allow them to give. So let's say you're sliding ventrally and the colon pushes your fingers out. You'll stop there, you'll stop sliding ventrally, and you can slide your fingers cranially or caudally to try and identify that it's colon. You can use one finger to push in on the structure, and if a dent stays there in the feces, that's how you know that it's feces and not, say, an intussusception. And intussusception is going to feel like a tube too, but it's much more rubbery, it bounces right back, it's painful, and if you slide your fingers forward or backwards, you'll feel that it gets narrower at one end than the other. And so hopefully you won't feel too many intussusceptions in practice, but you'll feel a lot of colons, and so you can tell that it's colon by pushing in. It's important to remember that you use all 10 fingers. You're not doing palpation with mittens, and so you need to use them separately. But you maintain the tension with the compression of the abdomen, fatiguing the muscles, by keeping your forearm muscles compressing, but you allow your fingers to move around what it is as you're sliding ventrally. So let's say you're starting dorsally and you slide your fingers ventrally and something sort of pushes your hands apart. You keep maintaining that tension with your wrists and you let your fingers go around the structure so you can identify what it is. You can then use your little fingers to slide it caudally, or you can use your big fingers to slide it cranially, so you can actually manipulate the structure within the abdomen. That's how experienced clinicians can actually say that there's a 4-centimeter mass on the caudal pole of the spleen, which seems like crazy to most students that they'd be able to feel that. But that's what they're doing, is they're stopping and they're manipulating the structure in order to actually feel it within the abdomen. And so once you've identified the structure and determined its character and texture, size, and so on, then you can continue sliding down ventrally. And so remember that you've got 10. Try and keep your hands flat, because this is pokey and painful. And you want to use the slide technique. So I reach my hands in, fatigue the muscles, wait 2 or 3 breaths until Westy relaxes, and then I slide my hands ventrally. And thankfully he's a normal dog. I only feel colon. And small loops of bowel slipping between my fingers, which basically just feels like little things slipping very quickly. You can't really identify them individually. Then I do the same thing underneath the costal arch. So I again fatigue the muscles and then slide ventrally. If there's any abnormalities, I'm going to stop and manipulate them. And then I do the same thing in the caudal abdomen. And in the caudal abdomen, you'll feel typically urinary bladder and colon. In a normal animal, those will be the structures that you feel. And you can tell that it's bladder as opposed to some tumor in the abdomen because it's compressible. Because it's tethered caudally, you can only slide it so far cranially before it snaps back. And when you push it into the pelvic inlet, it will change shape. It'll go from being almost spherical to actually flattening out as you compress the bladder and push it toward the pelvic inlet. So you can actually slide your hands around the bladder so that you can feel its size and its compressibility. You can confirm that it's bladder. You can actually, if the bladder's not too full, you can actually pull your fingers downward, and you have basically the fold of the bladder wall. You can feel both walls together, and if the animal is compliant enough. In rare cases, you can feel a big prostate in the pelvic inlet by actually tipping your hands backwards. So again, this is not ergonomic for the person because you have to actually get below the animal. I often lay my shoulder against the animal, maybe even rest my head on there while I'm talking to the client as I'm palpating these structures. And so you have to remember that you're sliding generally from dorsally to ventrally, but you do also slide from cranial to caudal. For instance, if the epaxial musculature is just basically a straight shot, from rib cage to sartorius muscle here, so there's no bumps. It's a straight shot there, and so if you're sliding your hands caudally in the abdomen towards the pelvic inlet, and suddenly your fingers feel like they're being pushed out around some structure. It's instead of the normal reflection to where the abdominal muscles insert on the pubic bone and on the medial aspect of the thigh, instead of that normal gradual flare, it's you're sliding your hands back and then there's this abrupt swelling. That might be that there is retroperitoneal or sublumbar lymph node enlargement or a tumor in that location. And so so just remember that you want to be gentle, slide, and allow your fingers to flex while maintaining the pressure with your wrists to keep the muscles fatigued. It's impossible to comfortably palpate the abdomen by doing this. Each time you press on the abdomen and each time you let up, they tense their muscles again, so you have to re-fatigue the muscles. So you're much better off to go slowly and slide. There's a few exceptions to that rule. For palpating the liver, you might also want to go from cranial to caudal, so you slide your hands off the rib cage, and you get to the costal arch, and the abdomen sinks in. But if you have another ridge of tissue there, so you go off the costal arch, and then there's yet another ridge. That's what you would feel if you had a hepatomegaly. Now, there are plenty of other ways that people palpate. There's some people who palpate from the bottom up, like this, waiting for things to fall through their fingers. There's some people who do sort of halfway what I'm talking about, where they get underneath them. They kind of get behind them and kind of palpate with their hands pointed in a cranial to caudal direction. And you can do that. He can sit for a second. You can do that And there's times where you might want to do that, but you're much less likely to be able to feel things, and it's much less likely to be comfortable for the animal if you do it that way. If you think about it, if you start with your hands this way, and you push in and try and push down in order to feel those structures slide between your fingers, you're effectively palpating with the tip of your longest finger. So it's very pokey. You're poking into the abdomen. Instead of the flats of your hands, of your fingers, you're kind of using the fingertips and the tip of the longest finger most. So this is kind of an uncomfortable way to do it. It's also very hard to manipulate something when you're pushing in that way. It's hard to fatigue the muscles as well when you're pushing from top to bottom. The same applies for those people who want to palpate this way. There's times when this might be comfortable or might be helpful enough, but to feel small structures and to manipulate structures within the abdomen, this doesn't work very well, because you can't, if it's oriented in a sagittal plane, you can't really push it back and forth very well, because each time you pull your hands this way, you're effectively poking into their abdomen. So sliding back and forth like this doesn't work very well from a comfort perspective for the animal. Whereas this, manipulating your fingers this way, works very well. It's not necessarily wrong, it's just going to be less sensitive and less comfortable for the patient. But there are times when I palpate from the bottom. If a dog with significant ascites, I might pull up and wait for something to fall between my fingers. So that's an indication where I might go from bottom to top. So there are exceptions to the rule, but generally you're going to be better off if you actually get underneath the animal and have your fingers pointed straight towards the ceiling, even though that's awkward for us. So for a big animal, I'm going to do that on the floor. My knees are still okay, and I can just kneel down. If your knees are not great, you get some help to put them up onto a table. For cats, I do the same technique with them on a table, but palpating with my fingers pointed towards the ceiling. There are some exceptions. Cats are very compliant. They relax their muscles very quickly, and so you might also want to palpate from dorsally to feel the kidneys. So you just slide your fingers underneath the epaxial musculature, and on the right-hand side you can slide your finger up underneath the rib cage in order to feel the caudal pole of the kidney. And on the left side you can cup the whole entire kidney in your fingers. I still palpate them from this direction though, because when I palpate them from dorsal to ventral, in addition to feeling the kidney size, I can, in my opinion, feel for irregularities in the contour of the kidney as well. So I think there's advantages to both.